Welcome back, guys. So this is going to be the 10th part of our RRB MCQ series. So till now we have completed 9 parts, and in this part we are going to further discuss some important questions which are relevant for the RRB examination. So let's begin. So the first question here says the sensitivity of blood leak detector used in hemodialysis machine ranges from. So here we have 4 options. The option A says 0.25 ml to 0.35 ml. Option B says 0.45 ml to 0.55 ml. Option C says 0.10 ml to 0.20 ml. Option D says 0.05 to 0.10 ml. So the right answer will be option A. So it is recommended to have a blood leak detection threshold at 0.25 to 0.35 ml of whole blood per liter of the dialysate. False blood leak alarms can be caused by the presence of air bubbles in the path or by cloudy or vertical optical sensor. Moving ahead to the second question, it says, in a wearable artificial kidney, which of the following chemical is used for regeneration of dialysate solution? So wearable artificial kidney is VAC system, and generally it has many compartments and many elements present in it, but the major element that is responsible for the regeneration of dialysate is, so we have given 4 options here. First one is xanthium oxidase, option B is zirconium, option C is cilium, and option D is caustic ash. So the right answer will be zirconium. So why is zirconium answer? Because wearable artificial kidney systems uses zirconium based sorbent cartridge to regenerate dialysate by removing urea, potassium, and other toxins, allowing dialysate reuse. Moving ahead to the third question, it says, following are the causes of CKD except. So we have to find the exception. So diabetic nephropathy, we all know it is the cause of CKD. Hypertension, nephrosclerosis, it is also related to nephron, so it can cause kidney disease. So yes, it is right. Option D is IgA nephropathy. We are also aware about nephropathy, and IgA nephropathy is very common cause of CKD, but cerebral aneurysm is not related to kidney, it is related to brain. So this is going to be the exceptional part. So answer will be C. Common cause of CKD include diabetes, hypertension, and IgA nephropathy. Cerebral aneurysm affects brain vessels and not related to kidney. Moving ahead to the fourth question, it says the risk of central vein stenosis is more with. So we have 4 options and we have to find the one which have the most risk. So option A is right internal jugular vein catheter, option B is femoral vein catheter, option C is left internal jugular vein catheter, and option D is subclavian. So I guess everyone knows this. So the subclavian vein catheter has highest risk of central vein stenosis. So subclavian vein catheterization has the highest incidence of central vein stenosis, which can comprise future fistula or graft creations, which can compromise. Sorry, I have mispronounced this. So if we do subclavian vein catheterization in some patient, it will come with the complications in future, and we might be not able to make the fistula or graft in that particular region. Moving ahead to the fifth question, it says, as per the CDC or Center for Disease Control guidelines, which one of the following patients should be dialyzed in an isolated area? Isolated area is where we don't do regular dialysis, because there are higher chances of infection to be get transmitted. So option A is patient with hepatitis B, option B is patient with cytomegalovirus, option C is patient with hepatitis C, option D is patient with HIV. So according to CDC guidelines, we do separate dialysis for patients who have hepatitis B. Now why is so? Because CDC dialysis infection control guidelines recommend strict in isolation for hepatitis B positive patients including dedicated machines and staff for them. This is because the transmission rate, if we compare, it is highest in the hepatitis B case. So that's why we CDC guidelines suggest to do isolated dialysis for such patients on dedicated machines. Moving ahead to the sixth question, it says the following are contraindications to renal biopsy. So let's read the question again. It says the following are the contraindications to renal biopsy except. So this is very important here, except. So we have four options. First option is solitary kidney, option B is proteinuria, option C is uncontrolled BP, and option D is uncontrolled bleeding diastasis. So we know solitary kidney, uncontrolled BP, and bleeding diastasis are actually contraindications, because if the patient is having any of these, we are not subject to do renal biopsy in such patients. But proteinuria, on the other hand, is indication. It is not a contraindication, it is an indication. It suggests that we should do a renal biopsy in order to find what the cause is. So let's see the explanation. Proteinuria is actually an important indication for renal biopsy to diagnose glomerular disease, and contraindications includes uncontrolled hypertension and bleeding disorders. Moving ahead to the seventh question, it says the juxtaglomerular apparatus is formed where the dash, let's say X projects between the afferent and the efferent arterioles next to Bowman capsule. So we have to find what will be on the place of X. So option A is distal tubule, option B is proximal tubule, option C is collecting duct, option D is glomerulus. So we know distal tubules are present. Juxtaglomerular apparatus is formed where the distal tubule projects between afferent and efferent. That's how we just form macula densa. So the distal convoluted tubules or macula densa come in contact with afferent and efferent arterioles, forming juxtaglomerular apparatus, which regulates GFR and renin release. Moving ahead to the eighth question, it says, it is a very easy question. It is asking us the molecular weight of creatinine in the Daltons. So option A is 113, option 2 is 1250, C is 84, and D is 60. So we all know creatinine weights 113 Daltons, making it freely filtered through the glomerulus and useful for assessing kidney functions. It is only a factual question, you need to know it and learn the molecular weights of some common compounds. Moving ahead to the ninth question, it says which one of the following vitamin is lost during hemodialysis procedure. So we have to find the vitamin that get easily lost, or we lose it while HD procedure is ongoing. So option A is vitamin B12, option B is vitamin A, option C is vitamin E, option D is vitamin D. So we all know A, D, E, K, these vitamins are fat soluble while the rest are water soluble. So since B12 is the only option that is water soluble and it can be easily removed during hemodialysis, so answer will be vitamin B12. So hemodialysis removes water soluble vitamins. Among the options given, vitamin B12 may be lost during dialysis sessions and often requires supplementation. Moving ahead to the 10th question, it says the following are ketone bodies which may appear in urine during ketoacidosis except. So option A is acetoacetic acid, option B is beta hydroxybutyric acid, option 3 is Banks-Jones protein, and option 4 is acetone. So we have to find the one which does not appear in urine during ketoacidosis. So answer will be Banks-Jones protein. And why it's so? Let's see the explanation. It says ketone bodies include acetoacidic, beta hydroxybutyric acid, and acetone. So these are included in ketone bodies. ketoacidosis process, while Benz-Jones proteins is an immunoglobulin light chain and is seen in multiple myeloma cases, and is not a part of ketoacidosis. So that's why Benz-Jones is not seen while the patient has ketoacidosis. So this was all about the part 10. Hope you enjoyed this video. Make sure to like and subscribe to our channel. Practice sheet of the same video will be available in our Telegram group, so make sure you also join that group.